All right, let's dive straight into this explainer. Today, we're unpacking a concept that is absolutely crucial, yet somehow constantly misunderstood in hospital operations. It's kind of the single metric that really defines a facility's true capacity and its financial health. We're talking about operational beds. To get our heads around this, just imagine your own house. Say you've got this massive spare room, right? It could easily fit 5 beds, but right now you've only set up 2 of them. Only 2 have pillows, blankets, and are actually ready for guests. Just having that physical floor space doesn't actually mean you're equipped to host a full house tonight. So look at it this way. Those 3 empty spots in the room, that's your potential space. But those 2 fully made beds, that is your actual ready-to-use capacity. If guests literally walked through your door right this second, you could only comfortably sleep too. Now, bringing this back to the healthcare industry, those ready-to-use spaces are what we call operational beds, or sometimes operating beds. This literally means the bed has the nurses, the specialized equipment, and all the resources attached to it right now. It's the beating heart of the hospital's day-to-day functionality. This is a perfect way to visualize how a hospital can have this massive, state-of-the-art building, legally licensed for, say, hundreds of beds, but strategically they might only operate a fraction of them on day one. Remember, a license just tells you the maximum legal limit of the building. It doesn't tell you the current clinical reality. So, you might be wondering, why wouldn't a hospital with 500 potential beds just set them all up? Why deliberately choose to only staff, say, 200 of them? I mean, on the surface, leaving perfectly good empty space in a brand new facility seems completely counterintuitive, right? Well, the answer lies in a really clever strategy called phased bed commissioning. This allows hospital management to carefully match their heavy capital and staffing costs to the actual number of patients walking through the doors. Because let's face it, you absolutely do not want to be paying salaries for nurses who are assigned empty rooms. The crucial takeaway here is that by holding back on staffing those empty beds, hospitals are effectively protecting their profit margins. This is especially true during that initial ramp-up phase when patient volumes are still growing. Honestly, it is a total masterclass in cost control and financial discipline. And if you're evaluating a healthcare business, say as a senior equity analyst, the gap between that total potential capacity and the currently operational beds is a massive signal. It's a key forward indicator of financial health. It shows you exactly how much growth runway a hospital has before they literally have to go out and build an entirely new building. Because of this dynamic, analysts strictly use the number of operational beds to measure current performance metrics, things like occupancy rates and average revenue. But they look at the unstaffed potential beds to model out the hospital's future growth trajectory. You basically have to separate today's execution from tomorrow's potential. Actually, there is a subtle analytical trap you need to watch out for here. It's kind of like a reconciliation landmine. Some operators will inflate their headline capacity numbers by lumping in managed network hospitals that they don't actually fully own. That can completely overstate their revenue base if you aren't careful. So always make sure you know exactly what kind of beds you're counting. So the next time you see a dark or empty floor in a new hospital, remember it isn't wasted money. It's actually a calculated, margin-protecting runway for future growth, just waiting for the exact right moment to launch. It really makes you wonder just how much hidden potential is sitting inside your local hospital right now.